Health care is the single most important thing we can do for America's long-term fiscal health. That is a fact.
If we have a government option, then sooner or later it will dramatically increase the cost. It will crowd out private health insurance.
This is indeed a happy day, for today we are introducing historic and transformative legislation that will benefit all Americans, America's Affordable Health Choices Act.
Yesterday, the Democrats introduced their version of health care reform, and this is what it looks like. Now, if anybody thinks that all of this bureaucracy is needed to fix our health care system, I would politely disagree.
The public option, whether we have it or we don't have it, is not the entirety of health care reform.
Obviously, the president, having just gotten back into town, is awfully anxious to engage in another rush and spend activity. He's clearly trying to get us to pass a health care bill before the August recess.
So the decision was made to give them more time.
Why don't they take the health care being forced down our throat?
We're entitled to be here just like you.
One day God's going to stand before you, and he's going to judge you and the rest of your damn cronies up on the hill.
I just don't understand how you propose to pay for this.
Why do you continue to support a Nazi policy?
On what planet do you spend most of your time?
I'm not the first president to take up this cause, but I am determined to be the last. The reforms I'm proposing would not apply to those who are here illegally.
Well, today's a big day. Many steps forward.
By the time the Finance Committee in this room votes on final passage for health care reform, there will be Republican support.
The best way to move forward is include a public option with the opt-out provision for states.
I certainly am not excited about a public option where states would opt out. I'll take a look at the one where states could opt in.
This bill is a wrecking ball to the entire economy.
Maddie says, don't tax me to pay for health care that you guys want. If you want health care, pay for it yourself.
The yeas are 220, the nays are 215. The bill is passed.
This Medicare buy-in is frankly another way to try to get to a single-payer, government-controlled healthcare system, and I and Senator Nelson think that would be bad for our country.
Mr. Reed of Nevada, aye.
The yeas are 60, the nays are 39.
With today's vote, we are now incredibly close to making health insurance reform a reality in this country.
One thing is very, very clear as I travel throughout the state. People do not want the trillion-dollar health care plan.
Don't walk away from reform. Not now. Not when we are so close. Let us find a way to come together and finish the job for the American people. Let's get it done.
Thank you very much for the invitation. I appreciate being.
Healthcare is very complicated.
The House and the Senate bill had some major differences, which we're hoping now to reconcile.
I believe the United States Congress owes the American people a final vote on health care reform.